In this image, we see the lung systems and connective tissues. So in Dr. Tung's 5 systems, the lung connects to the spleen in system 1, that's the tie-in relationship. And then in system 2, it connects to the bladder, and in system 4 as well. And then the system 3 connection is between the lung and large intestine. Now, the system 5 connection is between the lung and the liver. And in Oriental medicine, we typically think of the costal area as being related to the liver and the gallbladder. Well, if we look at this fascially, the parietal pleura, which surround the lungs, they connect to what's called the endothoracic fascia, and then this connects to the interior aspect of the intercostal muscles. So on the interior side of the ribs, we've got endothoracic fascia covering the inside part, and then connected to that is the parietal pleura, which surround the lungs. So this demonstrates that lung-liver relationship in the area of the ribs and the thoracic cavity. Now, if we take a look at another image here, we can see some other ways which the liver and the lung are connected. So here you see the image of the liver, and the blue arrows represent the connective tissues that connect the liver to other structures. So remember that ligaments and fascia are all part of connective tissues, and the left and right triangular ligament move from the liver into the diaphragm, and the coronary ligament also connects the liver to the diaphragm. So the diaphragm is part of the respiratory system, so we should consider it as part of the lung and its system connections. So at the diaphragm, we have the left and right triangular ligament as well as the coronary ligament connecting the liver to the diaphragm. And then on the superior side of that, the parietal pleura are connecting to the diaphragm. So the diaphragm also reveals the fascial relationships that exist between the lung and the liver. Now, there's also some other interesting things here. If we look at these other blue arrows, at the bottom corner, we see the hepatic flexure to the large intestine. So when the large intestine comes up and then turns, there's a close relationship there between the liver and the large intestine. There is also what's called the hepatoduodenal ligament, which connects the liver and the small intestine. And so that's that system 4 connection between the liver and the small intestine. Now, interestingly, there's some other ligaments called the falciform ligaments that connect the liver to the anterior abdominal wall, or what we can also call the superficial front line. So if you remember, the 4 horses as well as the 3 weights are also indicated for liver patterns and liver symptoms, but they're on that superficial front line or on the stomach meridian. So this can help us to better understand why points on the superficial front line, like the 4 horses and the 3 weights, can be used for liver disharmonies because of this fascial relationship from the liver through this falciform ligament and then to the anterior abdominal wall. Let's take a look at the next image where we see a diagram of referred pain here. And the orange areas in the neck and shoulder regions, these areas can become symptomatic and painful in cases of hepatitis or also when there's gallbladder inflammation. So what happens here then is that the diaphragm will become irritated. So if we take a condition like hepatitis where there's inflammation in the liver, that can irritate the diaphragm, and then it's going to move through these fascial connections. It'll move up through the parietal pleura, and then at the superior region of the parietal pleura in the area of the neck and shoulder, we can get these symptoms which we see there in orange. So in the area of gallbladder 21 and small intestine 13 and in the lateral side of the neck, and these are those gallbladder and small intestine areas, and of course both the gallbladder and the small intestine have connections to the liver. So here we see a very direct fascial relationship between a liver disharmony like hepatitis or gallbladder problems. We can even do this as well where we get pain and tension through the neck and shoulder area, and we can understand this through the internal fascial connections that exist. Now, this diagram or this image here doesn't show this, but the same type of thing can happen with an enlarged spleen, but it will happen on the other side.